the Agent Survival Guide podcast, Friday 5, our weekly recap of 5 things you should know about. I'm your host, Sarah Rueppel, and today is Friday, March 6th. I mentioned last week that Starbucks had some new drinks coming out, and I tried one on Tuesday. And it was on Tuesday, March 3rd, 2026, that I discovered I am not a fan of ube mixed with coconut. Not sure if I'd like it on its own, but I do not like the combo. Not a fan of the toasted coconut syrup, and in general, I don't think I care for macchiatos. I will stick to my lattes and my cold brews, but it was fun to try something new. And now let's get into our list because we had a lot of new updates from CMS this week. Starting out at number 5, checking back in on generous. Back in November, CMS announced a new drug payment model for Medicaid, the Generating Cost Reductions for U.S. Medicaid, or generous model. The generous model is a voluntary model that states and drug manufacturers can choose to participate in. The idea is that the model will help keep prescription drugs accessible for those who need them, lowering the price for both patients and the government in the hopes that more regular medication use will result in better patient outcomes. This week, CMS announced that they were extending the deadline for manufacturer participation in the program. The deadline for drug companies to submit their requests for application has been extended from March 31st to April 30th. CMS said in their release, quote, "Extending this deadline will allow for small and mid-sized manufacturers to participate and lower costs to the Medicaid program, providing more flexibility for state budgets and ensure that people who depend on Medicaid continue to access the care they need," end quote. The release also mentioned that June 30th, 2026 is still the final cutoff for manufacturer participation in generous. State Medicaid agencies, on the other hand, have a little more time to file their applications. That deadline is set for July 31st, according to a new banner on the generous page on CMS.gov. So far, only a handful of companies have publicly announced their participation in the program. No official word on the number of participating state Medicaid agencies either. We will continue to keep an eye on the generous model as we move forward into the spring and summer months for updates. Number 4, on Tuesday this week, CMS announced the new enhanced login for Medicare.gov users. The changes bring 2-factor authentication to Medicare.gov and update the site to bring it in line with other federal agencies. Medicare beneficiaries can now log in using either ID.me, Clear, or Login.gov. CMS has been working to fight fraud in the insurance industry, and this enhancement is an extension of that mission. The updates add extra security and a step to verify that the person logging in is the Medicare beneficiary they claim to be. Hopefully, this will prevent others from fraudulently accessing Medicare information. New login methods are available on and offline and do not require access to a smartphone. ID.me and Login.gov allow beneficiaries to verify their identity in person at select locations, over the phone, and online using computers in a public space. And if you're wondering if beneficiaries need a real ID to verify their identity, no. Medicare beneficiaries don't have to have a real ID or even a driver's license. They can use a state-issued photo ID, U.S. passport, or other accepted documents. And to quickly go through the assistance options by login method, ID.me offers live chat support 24 hours a day, 7 days a week. They offer video assistance and in-person verification options at certain locations. Clear also offers a live chat and helps Medicare beneficiaries log in over the phone. Login.gov offers a live chat, helps Medicare beneficiaries log in over the phone, and offers in-person verification options at certain locations. And another interesting tidbit in the release, quote, people with Medicare do not need to create an account to access general Medicare information or their individualized Medicare information, end quote. When navigating to the Medicare.gov site, however, there is still a banner prompting creation of an account or logging in for the best experience. Little bit of mixed messaging there, good to be aware of just in case the client sees that and is a little confused. We will be linking to the CMS press release in our episode notes. Number 3, the Trump administration, through both the Department of Health and Human Services and the Centers for Medicare and Medicaid Services, have been working to cut down on fraud in the healthcare industry as a whole. Last week, a few new initiatives in that effort were announced. The first, and CMS sent their notification of this action back in January, the deferment of $259.5 million in federal Medicaid funding for Minnesota. CMS says that dollar amount, quote, includes state expenditures of $243.8 million for unsupported or potentially fraudulent Medicaid claims and $15.4 million related to claims involving individuals lacking a satisfactory immigration status, end quote. CMS specifically noted, quote, unusually high spending and rapid growth in certain service areas, including personal care services, home and community-based services, and other practitioner services, end quote. Minnesota will be given the chance to respond and correct the information CMS has deemed unsatisfactory. But CMS did mention in the release that they are prepared to take additional action. Their plan is to withhold an additional $1 billion in funding from Minnesota's Medicaid program over the course of this year until its standards are met. And then also announced in the same release, our number 2 story this week, the nationwide enrollment moratorium on new durable medical equipment, prosthetics, orthotics, and supply companies in Medicare. Now, whether this subset of the industry stood out during the CMS audit of Medicaid in Minnesota, or just Medicare as a whole, that is tough to tell, but they've identified durable medical equipment as an area of concern and potential fraud. CMS claims that their efforts in this area have already saved $1.5 billion in fraudulent billing last year. The moratorium would last for 6 months and, quote, applies to all applications for initial enrollment and changes in majority ownership for medical supply companies, end quote. And then in addition to the moratorium, CMS plans to publish essentially a blacklist, publishing information about providers and suppliers they have removed from the program. The list will identify the provider or supplier, their national provider identifier, and the reason their participation in the program was revoked. Very interesting to see what that list looks like when it's published, so we will be keeping an eye out for updates there. And then coming in at number 1, let's talk about the overarching initiative that CMS is calling CRUSH, which stands for Comprehensive Regulations to Uncover Suspicious Healthcare. CMS is calling for stakeholder input in their efforts to, quote, prevent, detect, and respond to fraud, waste, and abuse, and program inefficiencies in Medicare, Medicaid, the Children's Health Insurance Program, CHIP, and the health insurance marketplace, end quote. The request for information calls on states, providers, suppliers, payers, tech companies, patient advocates, beneficiaries, and others to add their comments to the Federal Register by March 30th, which feels like a pretty tight turnaround time compared to normal comment periods. CMS outlines their 2025 achievements at the end of the press release, so you can see what they've done so far. And if you'd like to comment, we will have the link in our notes to do that. Highly encourage participation, whether you have comments on their efforts so far or if you have ideas on where they should focus their efforts in 2026. A lot of updates from CMS this week, and we did not even get into the potential restriction of HIV drug access or some of the changes in Part D enrollment that we are seeing in 2026. And for those of you who attended Craig Ritter's State of the Senior Market presentation yesterday, I just want to say thanks for attending and making that event a success. I hope you enjoyed it. I know I did, and I learned a lot, took a bunch of notes. Hopefully you were able to take away some nuggets as well. If you'd like us to do an episode recapping some of the highlights from his presentation yesterday, please let us know. We are happy to dive into that for next week's episode. And with that, I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Rueppel. Script editing and fact check by Emily Ryan. Podcast design by Urban Rivera. Like what you hear? Follow along with our show wherever you get your podcasts.